Karin, thank you very much indeed for doing this. We will come on to talk about health in a moment, but I do have to ask you, obviously, about the main story today, which is what's happening inside Downing Street. It's pretty clear there is a bit of a toxic atmosphere, isn't there, inside Downing Street, given all the briefings we've seen in the last 24 hours.
So I do want to talk about health, and that's what we're focused on, and that's what Wes Streeting is out in Manchester today talking to NHS leaders. Look, I understand there's other stuff going on, and I think it needs to stop. I've got no time for it. I never have. When I was an activist back in Bristol under the last Labour government, I used to be shouting at my television or shouting at my radio. So that's where I am, and we are very much focused on delivering the change that we promised for people in the health service, and that is what Wes Streeting is doing today.
But in saying that, clearly some people are not focused on that because they are briefing against
Well, they don't have
ministers.
enough time, they don't have enough to do, so I think they need to be much more focused.
Does the Prime Minister need to sack someone?
Look, that is up to him. He's very focused. I've worked very closely with Keir Starmer. I was his PPS during the Brexit years. He is a very focused person. He's got no time for this stuff either, so I'm sure he will make sure that we're all focused on what people want to talk about, which is about the health service.
Indeed, but
and that is what Wes is out doing today.
Indeed, but we can only focus on these things if government operates. What's very clear, and I say this because it is very clear, that inside Downing Street things are not working, and they haven't worked for a while. The greatest sign of something that's not working is a churn of staff. Downing Street loses people left, right and centre, and has done since Keir Starmer became Prime Minister. Let's be honest about this. We know this, your colleagues know this. Downing Street is not working.
So government is working. That is
why
why
are they briefing against each other?
Government is working. That is why we're out making the changes to the health service. Keir Starmer appointed all of us in the health team to get on with the job. We were very privileged to be asked to do the job in July 2024, confirmed in the recent reshuffle to get on with the job because we are delivering those extra GP appointments. We delivered 5 million more appointments than we said we would do. We are out today talking about the next stage of those changes, about modernising the health service, making the changes we promised, bringing NHS England and the department together, reducing duplication, getting more stuff to frontline services, supporting staff to get that services, the change that people really want. That is government working. I understand there's other stuff going on, and that's very interesting to people here in Westminster at the moment. And it's right that it stops. It's right that it stops.
This story came about
but
because
we are very
someone
focused.
in Downing Street, or some people in Downing Street, decided to actively call up journalists.
Yeah, and they should not do that.
So when you say it needs to stop, how can it be stopped?
Well, that is beyond my pay grade. My job is to...
You're a Labour MP, you've got a view
and it needs to stop. So that is my view as a Labour MP.
How does it stop?
That is up to the Prime Minister to decide how he wants to run the rest of his government, and that is up to him. And he is very focused on making sure that we're always focused on the priorities of the British people.
Do you have full confidence in Keir Starmer?
Yes. So let's get on with the job that we all want to do, that we are doing.
Do you think he should lead Labour into the next election?
Yes.
He's the most unpopular Prime Minister in British history.
I have total confidence in Prime Minister Keir Starmer.
Why do you think he is?
And we are going to keep focusing on what we need to be doing, which is delivering the change that people want to deliver.
Why do you think
and when they see the change that we are delivering and they feel it in their pockets and they see it in what we're doing in the health service, which they're already starting to do, that is what we will take into the next general election.
Why do you think he is so unpopular? You talk to your constituents. I assume that lots of them don't like him. What are you hearing on the doorstep? Why does every single opinion poll show he's the most unpopular Prime Minister?
Well, there are a lot of opinion polls which I don't look at, and I do talk to my constituents every week when I'm in Bristol, and they email me regularly. And genuinely, what they are focused on is what is happening day to day in their lives, and they are very realistic, actually, about how tough it is to change round government. They're actually quite realistic about the depth of the changes that we need to make. So they are like, well, you know, we don't like a lot of things, we want things to change, we gave you a chance, get on with it.
OK, let's talk about the health reforms. What are you trying to achieve here?
We are bringing together NHS England, together the Department of Health, to reduce duplication. We've effectively got 2 head offices, so we're reducing that duplication. And we're also making changes to these bodies that were set up under previous government called ICBs. They're regional bodies that have had not very clear roles, and there's a lot of duplication. So we're reducing that headcount by 50%, making them much more focused on what the wider population wants from its health services, rather than duplicating a lot of tasks.
And a lot of this, from what I can see, is redundancy. or trying to entice people to redundancy, isn't one of the problems that we've seen elsewhere in government is that when you lose experience, as we've seen in the Ministry of Justice, that is not a good thing. Is there a risk here that you actually, in order to save money and bring down numbers, that you lose experience that could get the health service, a bit like the prison service, in trouble in years to come?
We are really conscious of that. I'm a former NHS manager myself. I've been through these sorts of changes, and the need for us to make sure we hold on to talent, that we're very focused on what the task of these organisations is, to reduce the duplication, to make sure people are very much focused on delivering that change to frontline care services, including digital, that we retain the talent we need and make sure the right people are in the right jobs in the right place. So we are conscious of those sorts of risks, and what the Secretary of State is doing today, because there has been a time lapse that we would rather not happened between the announcement of the changes and that clear delivery, is saying to those people, you know, we value the work that you're doing, we would like to happen quicker because it creates uncertainty, but now let's all get together and build on the massive changes that we've made in the first year.